Before the Care Navigator role was developed, it was quite a strain on our GPs. When we done the research into this, we found out that there was a lot of social appointments being made with the GP. We then looked into this and came up with this idea of the Primary Care Navigator.
We have a wide variety in our role, but basically it's social prescribing for all those patients out there that don't have a medical need as such.
Although we're not medically trained, we are clinically trained. This helps with the role because you do then see people when you know something's just not right.
We are the first point of contact for all of the nursing homes in the area, the chemists in the area who support those nursing homes. Anybody with dementia, Alzheimer's, carers, anybody actually that needs our help basically, so they don't have to go through reception to be put on a list for a wait for a call back. We have a direct telephone line so they can just ring us direct.
We found out that there was a lot of things out there that is actually free for people to attend, and this really helps with people who are isolated. We just need to get out there and find out what's there for them. We met our local networks, we introduced ourselves and looked to see what we were aiming for. Once you start to get to know all different people in different networks, it becomes sort of a big circle where we all share ideas and pass on information to each other.
What we're doing is actually we're galvanising the population of the practice and all the voluntary organisations around the practice. As people are losing their service in the community, they always come to the GP as their single point of contact. And by having these care navigators in the practice who also have some clinical skill as well, what we're doing is actually managing those patients through population need rather than a 10-minute GP appointment.
Jane and Julie normally phone me on Thursday morning, and we'll have maybe half an hour's chat on the phone. And they're just sort of asking about my welfare, my health, how am I feeling. And they seem to give a lot of support over the phone. And I have met them on several occasions. And I just think they're lovely. Be two angels, man. They are. They're great. I think every town, village and city should have something like this. Because obviously one of the things that bumps you off pretty quickly is loneliness, isn't it?
What we found was actually in the first 6 months of having the role, we were starting to reduce admissions into hospital, patients were coming in out of hospital quicker, and we'd started to do lots of work with voluntary organisations to actually deal with the social needs of patients rather than just the health needs.
What I enjoy most about the role is the satisfaction of the patients at the end of their journeys. It can be anything from a very small thing to a housing issue, a financial issue, a caring issue, a bereavement. It can be anything, but it's seeing that satisfaction at the end of the journey, and that's what makes me happy.